Chapter 7, Enamel. After reading this chapter, you should be able to describe the physical features of enamel. We're going to talk about the structure of enamel rods, incremental lines, lamellae, tufts, and spindles. We're going to discuss how each one of these things will affect the permeability of enamel. We'll discuss the surface characteristics and etching of enamel. Some of the physical properties of enamel are that it is hard and brittle, which makes it subject to fracture. 96% of enamel is an inorganic material known as hydroxyapatite, and only 4% of enamel is an organic material, and that is water. The organic component of enamel is enamelin, and it is similar to the protein keratin found in our skin. Enamel is a grayish white and appears slightly yellow because it is translucent, which allows the dentin that lies under enamel to kind of show through. Thickness of enamel can range from knife-edged to about 2.5 millimeters thick, and the thickest enamel layer is on the occlusal, where the load is the heaviest on the tooth. Enamel rods are what form enamel, and they're made up of, each rod is made up of 4 ameloblasts, which are the cells that make enamel. One of the ameloblasts forms the rod head, and then part of 2 ameloblasts will form the neck, and then the 4th ameloblast forms the tail. I think they almost look like a fish. The anterior teeth have about 8 million enamel rods, and molars have 12 million. Each rod is filled with crystals. The rods form perpendicular to the DEJ and curve slightly towards the cusp tip of the tooth. They form almost perpendicular to the enamel surface at the cervical region and are more gnarled and intertwined up near the cusp tips. The surface of the rod is called the sheath, and then the center part is called the core. There are light and dark bands that appear when light is projected at the surface of enamel, and those light and dark bands are called Hunter-Schreger Bands. If you can look at this image, I think these are in your book too. The DEJ is being identified for you, and you can see the enamel rods run perpendicular to that dentoenamel junction. And this is why I think they look like little fish. You can see the head of the rod is 1 ameloblast. 2 ameloblasts make up the body, and then the tail is another ameloblast. And then they kind of fit together like puzzle pieces. Here's another look at the enamel rods running. They said cervical. It runs almost perpendicular to the enamel, and then you can see as we go up towards the cusp tip, the gnarled enamel where it's all kind of intertwined is up at the top. These Hunter-Schreger bands, you can see the DEJ where the more brown material meets the pink. That's the DEJ, and you can see the rods, and as things have been laid down incrementally, we see these alternating Hunter-Schreger bands. The incremental lines are also called the striae of Retzius. These result from that rhythmic deposition of enamel. They can be accentuated based on the mineral deposition at the time the enamel is laid down. So I always kind of think of like a tree trunk. You know how they say if you cut a tree across its trunk and you count the rings, you can tell how old the tree is. Well, in a tooth, if you cut the tooth crossways, you can see these incremental lines where that enamel was laying down as the tooth was forming rhythmically. And every layer has a little bit different mineral content, so that's what makes each layer look a little bit different. And when enamel is laying down, it's not probably a perfectly consistent procedure, so it'll lay down and there's a little bit of hesitation, and then another one lays down, and so it creates these differences in these lines. They have found a neonatal line, and this is accentuated an accentuated incremental line of retias due to environmental and nutrition changes they think at the time of birth. So they've associated this particular line where everything prior to that line was laid down and developed before birth, and then everything afterwards is at the time of birth. And so that's why they think it's due to the environmental change where the baby is no longer in the mom's body and now their nutrition has changed, everything's kind of changed. So that's called the neonatal line. Postnatal enamel has many spaces that are stained, so that prenatal enamel has fewer defects, and so that's why it creates such a differentiation there between the two. Enamel lamellae are cracks in the surface of enamel. Now these you've heard them called Kray's lines. You can actually see these with the naked eye. When you look at someone's tooth and you shine or transilluminate light through them, you can see these little cracks, and they are cracks in the tooth, but not enough to actually fracture the tooth. They could at some point. They feel like possibly these form during the development of the enamel and can create an organic pathway or tract. They also think it could be caused by stress cracks due to impact or rapid temperature changes. We used to see this in our patients that chew on ice a lot. If they've sustained, if they've abused their front teeth for using their teeth for things they shouldn't. These appear like a leaf-like little line. If you look right there at that image that I have for you, you can see that little lamellae goes down through the cartoon tooth, and then the one on the right is a microscopic view of that tooth. So it looks kind of like a leaf. They believe this is a possible area for bacteria and caries to develop. Enamel tufts are located at right angles to that DEJ. They are 1/10 to 1/5 of the way from the DEJ to the outer surface of the tooth. You can see we've got the DEJ here, dentin underlying, and then the enamel tufts come up. These are filled with that organic enamelin protein. The DEJ is scalloped, so these tufts rise from those scalloped peaks. Enamel spindles will arise at the DEJ, and they actually extend into the enamel. They are extensions of the dentinal tubules that we have mentioned in previous chapters. They may contain the living process of odontoblast and possibly give sensitivity to the inner enamel. The spindles are shorter than tufts, so they're only a few millimeters in length. We're going to talk about surface characteristics of teeth, of the enamel. So the surface of enamel may be smooth, or many times we'll see these ridges, fine ridges, and they're typically in the bicuspid to premolar area, more prominent near the cervical region of the facial side of the teeth. And parachymata are just imbrication lines that are external manifestations of that striae of Retius, or those incremental lines. So for a hygienist, these areas can make you think there's calculus there because they're bumpy. But since they're enamel, we know that enamel is the hardest surface in our body, and you could scale all day long and you're not going to be able to remove them. Another way you can know that they are parachymata is you would see this probably bilaterally. We'd see probably on the opposite side of the mouth the same finding. The outer enamel also has a zone of prismless enamel, 20 to 40 microns thick, right near the surface. We don't see those Hunter-Schreger bands or the light and dark bands in this zone, and that prismless zone of enamel is a structureless microcrystalline area of enamel rods that are nearly perpendicular to the enamel surface, and these enhance the bond strength of composite restorations. Enamel is permeable. It allows the passage of fluid, bacteria, and bacterial products through it. So this is a really important thing for us to think about when we're talking about clinical therapy. When we talked about bleaching, we talked about how the bleach material can penetrate between the enamel rods and actually oxidize stains. So it is important to know that enamel is permeable, and the things that we place on the tooth like fluoride, bleach, acids, things like that can penetrate through. So they can also pass through the enamel more rapidly if we do see those lamellae or cracks or tufts or spindles. Those minute spaces around enamel rods and crystal spaces within the rods are called microlamellae. And then the crystals of hydroxyapatite that we see in the enamel are about 30 times larger than what we see in dentin. So to etch a tooth, in order to bond, say, a sealant or a composite to the tooth, we actually use a diluted acid that alters the surface of the enamel. The acid will selectively etch the ends of enamel rods, which provides a greater surface area so that the materials can adhere to the surface of that enamel. The rod sheath, which is the outer covering of the enamel rod, will resist demineralization more than the core. So the inner part of the rod etches much more easily. It's more sensitive to demineralization as well. And the hydroxyapatite is seen in that outer covering or that outer rod sheath. Here's an image to kind of show you. A is an enamel crystal that has not been etched. And then we'll look at the image B, which is a partially dissolved enamel crystal. And remember, the outer sheath does not dissolve as easily. So we can see the etching taking place in the core. And now we can see dissolved crystal on the one that looks like a C. Plastic resin will then infiltrate around those crystals and kind of grab a hold of those etched areas in the enamel.